The Partnership for Healthy Texas is a coalition of almost 50 local and statewide groups who have come together to focus on obesity prevention, really from the age spectrum, early childhood to aging adults.
Partnership for Healthy Texas is a tremendous collaboration. I'm very inspired by it. These 50-plus community organizations and national organizations all have one common purpose and passion, which is to save children from the crisis of obesity. And it takes that kind of drive and focus, and getting everybody together in the same room is extraordinarily successful.
We've been able to really advance our issue and build a network into those local communities that have provided us not only with policy suggestions for legislation or regulatory issues, but also volunteers and networking, and then of course access to lawmakers when we've needed to really pull up some local volunteers and address the issue at the state capitol.
The partnership works really hard to be representative of all of our different members when we're developing our priority issues.
For these organizations, they save a lot of time by joining the partnership, and a lot of resources, because they can go to one meeting and get all their work done as opposed to meeting with these 50-some organizations individually.
Being part of the partnership has allowed us to be part of the policy-making body who sends legislation forward, advocating for healthy lifestyles, for good nutrition, for PE, physical activity, and those sorts of things, coordinated school health.
The partnership is instrumental in disseminating what is known and what's real and what the risks are and the health problems. So we need these organizations to be a conduit from academic and public health research to elected officials and community organizations that can make real decisions that can help people in Texas.
We have relationships with legislators that we didn't have before. We have a dialogue in the legislative process that we didn't have before. And we have key leaders and roles in Texas that have taken this on and made it an important part of their legislative objectives.
The partnership has really done a lot to help legislators see that prevention is the solution to this problem we have of childhood obesity.
By going in collectively with priorities that identified evidence-based policies, things that would actually have an impact. So instead of beating back bad legislation during a session, we actually were able to start putting forth good policy recommendations and helping legislators work the policies through.
Our policy recommendations go through a really strong vetting process, which means they're really well researched. And so by the time we have our recommendations, policymakers and people know that they can rely on them. And I think that's really critical to having a voice in policy, that people know they can rely on your recommendations.
A lot of the things we weren't talking about 5 years ago, we talk about now internally at the American Cancer Society because of the work of the partnership.
And they have been a fabulous collaboration for us to be involved with, to have our voice amplified at the state capitol.
Because the Partnership for Healthy Texas is basically a volunteer organization, we continually grow with help and support from the many advocates at the community level.
That one large voice is so much louder than each of those individual voices could possibly be. They have been very successful in accomplishing their objectives of providing for healthier Texan children.